name's Maria Duffy. I'm a GP in Pollock in the south side of Glasgow. It's the 8th of May 2020 and the health service and the rest of the country have been on restrictive or lockdown measures for more than 7 weeks. And I wanted to speak about the changes that have happened in primary care to adapt to the COVID-19 pandemic. This is the central atrium at Pollock Health Centre, and it's not usually as quiet as this. And general practice has continued to run throughout this COVID epidemic, but we've achieved it by adapting to new ways of working. And we've done that by cohorting symptomatic patients to community assessment hubs while keeping the core GP services running. And we've done that by adapting to these new ways of working. And central to that has been triaging all calls. So we've gone from majority of calls being face-to-face to almost all calls in the first instance being triaged by telephone. That has also meant that we've had to do a lot of remote working. We've had to risk assess our staff, and staff being on isolation but still well enough to work. And we've got a lot of staff working at home. We've used video consultations, which I'll show you later, which is an Attend Anywhere software, where we're seeing a lot of patients and doing the consultation by video. We've also used Zoom and Microsoft Teams to achieve some of the tasks that we require in general practice, particularly the team huddle in the morning, where all admin, pharmacy, medical, nursing staff attend to work through the new pathways, any problems that have occurred the day before or any significant events. We've also done remote tutorials for people who are perhaps shielding at home or isolating at home. We're still being able to achieve tutorials and assessments for trainees. Of course, all patients are seen with PPE, and we've had to adapt our rooms so that they're easy to clean. We've done a lot of work on shielding. Given the expert advice that we've had, we have to make some judgments because it's for very high risk patients and it's austere and very strict social isolation, and so that's been a lot of work the last few weeks. We've taken a holistic approach. We have a links practitioner in this practice. It's an area of high deprivation and our patients are most at risk for various reasons, but we've used the links practitioner to liaise with patients and with local organisations to mitigate the impacts of the social isolation that's been imposed and some of the economic fallout of these measures. This is Pete Road Medical Practice morning huddle that happens every morning. It's a whole team meeting.
I'm Anthony, I'm a GPST3.
Hi, I'm Nicola, I'm a pharmacist.
I'm Lindsay, I'm one of the GPs.
Hi, I'm Naomi, I'm GPST1.
Okay, so we'll start the huddle. Morning everyone.
Morning.
Receptionist, practice manager and the practice nurse also attend. Usually this meeting lasts 5 minutes, but due to the number of changes during the COVID pandemic, it now lasts about 15. Because we continue to see patients, we've had to ensure that rooms are easy to wipe clean between consultations. The waiting room has also been altered in order to allow social distancing for the few remaining patients who require to be seen face to face. So this is the Attend Anywhere software that we use for video consultations. There's a camera and speakers, and there's a virtual waiting room. The patients are given information by reception as to how to access the virtual waiting room, and we click on the patient's name and then we set up a video consultation. It allows us to see rashes and lesions, and quite often means that we don't need to do a face-to-face consultation. This week we participated in a remotely led learning event offered by Cancer Research UK on strategies to continue early detection of cancer during the coronavirus outbreak.
Your processes after the lockdowns lifted, how do you envisage practices will be able to catch up?
Okay, well, as you know, the 3 cancer screening programmes are paused. And yesterday we had the cervical screening steering group, and we were looking at what measures we can put in place.
Our links practitioner has been very active.
So during the coronavirus period, we've had to adapt to meet the needs of the local population, so that they can stay home and stay safe and live as well as they can. So we've worked a lot with local organisations to provide support around food home delivery services, prescription delivery services, staying well and keeping well in homes by accessing also mental health support services and supporting people to access activities to stay home and stay healthy too.
This is us in Bar Street at Woodside in the centre of Glasgow, and this is one of the COVID assessment hubs for symptomatic COVID-19 patients. So these are cohorted away from the core general practice to reduce risk of infection to staff and to other patients, to allow primary care general practice still to function. It's staffed largely by general practitioners, and there are very strict pathways in place about how patients present. They wait out in their car, and there's PPE all the way into the health centre, all staff, and a reduction in the amount of time, clinical time, that doctors and nurses spend with patients to reduce infection risk. So general practice within a few days of the lockdown measures was putting these new measures in place, and I think it's fair to say that we've worked with speed, at pace, we've been agile, and most importantly, we've worked as a team.